Okay, hello everyone. It's nice to see you all here. Could we all rise for the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. If we could just have a moment of silence for all of our first responders, our military, and all of those who are suffering at this point in time. Thank you. Thank you. Okay. I'd like to introduce the board members. No particular order. Bill Gerstenstang. Darrell. Who's Darrell? Myself, Rosemary, Jenny, Maria, Ed. Who's at the end? I can't see. Oh, Noreen. And Joe. Okay. Thank you all for coming. We have, do we have any officials here? Yes, we have an official right here before us, Alice Roker. Here she is, Councilwoman Alice Roker.
Town clerk. Rosemary?
Yes, dear.
We also have our town clerk, Diana Quast.
Oh, yes. Where is she? Here she is. She's little. I didn't see her. Diana Quast, yes. Okay, did I leave anybody out? Town official?
Superintendent of our parks, Jim Materano, Jr.
James Materano, there he is. Okay. Okay. Very good. Thank you all. I just want to make one comment about all of these people and all of the people you see here at the table. It takes a lot of people working together to put any of these situations together, and I'm very thankful that we can do that in this town. Everybody gives their all and is very nice and pleasant to work with, so I just wanted to get that out there. I also want to mention our lunch sponsor, New York Presbyterian Hudson Valley Hospital. They always come through for us, so I'm very happy about that, and we'll have a guest speaker later on from the hospital. Now I would like for, first of all, I want to take this moment to, is Vishnu still here? No, okay. I want to take this moment to introduce a woman who has served this community for many, many years and who chose not to run for re-election. And I'm sure, I hope you don't think we're not going to call you from time to time. I don't, because we are still going to reach out to you. Okay. So a wonderful person, Alice Roker. I'd like to thank her for her years of service to the community. And of course to inform her that we still have her number so we can call her from time to time.
I heard she changed her number. Effective January 1.
Alice is going to get up and talk to us a little bit about our guest speaker today. So Alice, thank you very much. And thank you for all the work you did to put this together. Thank you.
Good afternoon, everyone.
Good afternoon.
I don't know, but during the day when I'm home and I turn on the TV, I've watched all of these Medicare, the open enrollment commercials, and after a while, I got really angry because they're misleading.
That's right.
And then I read an article which talked about seniors in Michigan. Scammers are a part of the world. They scam everything. And so what started happening in Michigan was that these scammers would go around to the homes of seniors and would say, we can sign you up for an open enrollment program. And of course, what they wanted from the seniors were their Medicare numbers and their Social Security numbers. And not only were they coming around to different areas of Michigan, they were also calling people on the phone. And generally what I say to people, if somebody calls you on the phone trying to sell you something, hang up. I generally don't answer my phone unless I know who's calling me, because there's so many people that want to sell me more insurance for my car.
I tell them I don't have a heart, so don't bother me anymore.
No, I hang up purposely because that creates my own do not call list. Scammers know who not to call. And I know a lot about this because while I worked for NBC, I worked with a woman named Betty Furness, who was a consumer advocate beginning when she was appointed by President Johnson. Then she went on to serve New York State under Governor Rockefeller, and then she became the head of New York City's consumer department. And what we were all taught, those who worked for her, was that you have to listen. You have to be careful. You have to listen. You have to learn to read. Because that's the only way you get to understand whether or not they're scammers or not. But she said something which I know all of you understand. If it sounds too good to be true.
It is.
It is.
Right.
I called Rosemary and I said, Rosemary, what do you think about the Medicare commercials? And she had a particular issue that I saw but did not pick up on, and that is these companies use a facsimile of their Medicare card. So you might tend to think they're from the government, and they're not. And I said, oh, that's a good one. We can take that one to the FTC because that's a more nationwide organization. So I said, well, if I get someone to talk on this issue, would you like to do a program? And she said, yeah. And I said, well, I'm going to an event over the weekend, and I'm sure I'll find someone. And I talked to the county exec and his deputy about what we wanted. And he said, no problem. And a couple of days later, I got this phone call from this young woman named Diane Punet, who's here today with Laura Markowitz, who she works with. I'm going to read you a little bit about what she said to me, and I kept going, nah, you don't have that, nah. She is part of the county's senior services program, and there is a portion of that program called HICAP, H-I-C-A-P. It works directly with Medicare beneficiaries to educate them about the Medicare program. And she went on and basically said you can get educated. You can call them and have a personal consultation, or they're in, I think, the Heart Library on Tuesdays, I think you said. And I think that if any one of you are concerned about whether or not you're getting everything you want out of Medicare or everything you need, you might want to give them a call. But I'm going to let Diane come up and speak.
So I'm just going to pick up from where Alice left off. In terms of where to turn for unbiased information when it comes to Medicare, because the Medicare system is very difficult to navigate. There's the Medicare Part D drug plan, there's Medicare Advantage plans, there's Medigap, Medicare supplement plans. These are all different Medicare products, and it can get very confusing. So you would want to turn to where you could reach out to someone who is totally unbiased. So our office, I'm with Westchester County Department of Senior Programs and Services, and we're the Office for the Aging for Westchester County. And our office has a Medicare information line, and our Medicare information line has counselors who are HICAP trained. And HICAP stands for Health Insurance Information, Counseling, and Assistance Program. And our counselors are available Monday through Friday from 8:30 to 4:30. And you can reach us at 914-813-6100. We also partner with the Westchester Library System, where we have HICAP trained volunteers who can also provide unbiased counseling. And you can reach them if you want to reach out to the library itself at 914-231-3260, and that's the Westchester Library HICAP helpline. We also have, through our partnership with the library for the HICAP program, we have one-on-one in-person counseling that's available at the Hart Library, which is on Tuesdays from 10 to 1 p.m. There's no appointment necessary. It's walk-in, and you can sit down face-to-face with a counselor. We also have counseling available at the Will Library, which is on Thursdays from 10 to 1 p.m. There is also an upcoming virtual Medicare 101 workshop, and that's coming up on December 1st. And the workshop runs from 10 a.m. to 12 noon. And to register for that workshop, you can call 914-813-6389, and we'd be more than happy to register you for that workshop. So there's a few products that I mentioned earlier, but the two that I'm going to focus in on is the Medicare Standalone prescription drug coverage and the Medicare Advantage plans. So when it comes to the Medicare prescription drug coverage, there's 19 available drug plans that you can choose from. But you cannot randomly choose one of these plans. What you're going to have to do is you're going to have to do a matchup. And what I mean by that is that you're going to have to match up the medications you're taking to the formularies of those plans. And right now we are in what's called Medicare Open Enrollment, which runs until December 7th. Every year between October 15th and December 7th, individuals who are in a Medicare Part D drug plan have an opportunity to change their plan for the upcoming year. So in order to select a plan for yourself, or what would be the best one for you for the following year, you would have to go on to the Medicare.gov website and utilize what they refer to as the Plan Finder. Now, on the Plan Finder, what you would do is you would put in the medications you're taking, the dosage amounts, how often you're taking it, and what it does is it then takes that information and matches it to the available plans. And like I said before, there's 19 of these plans available for 2022. Once it does that matchup, it'll then rank the plans in order, where the most cost-effective ones are displayed on the top of the screen, and as you work your way down, it gets less effective. Things to consider when you're looking at these drug plans is that they will classify the medications into different tiers, not just the formulary, but also the tiers. And the different tiers, tier 1, tier 2, tier 3, specialty tiers, the higher the tier, the more expensive the copay portion is going to be for that particular medication. So the way the plans are structured is that if a plan has a deductible, and not all of these 19 plans have a deductible, the highest the deductible can be for next year would be $480. Then after that, if you do have a deductible, you have to meet that deductible first, and then you go into the next phase, which is that the plan pays a portion, and then you pay a portion. And it's a 25-75 split. And you'll go along that way until you've reached a drug cost of $44.30. And at which point, most of you will recall the terminology, you've entered the donut hole. But the donut hole has been closed out. Regulation has changed where that donut hole is closed out. So during that phase, you will still have that 25%, 75% split. And then you will enter into what's called the catastrophic phase, which is at $7,050. Now, with these drug plans, as I mentioned before, it's important for you to take a look at your current coverage and make sure that if you are not going to change your plan for next year, that you understand what the coverage is going to be for the current plan that you're in. It's also important to note that if you do not have a Medicare Part D drug plan in place and you do not have coverage elsewhere, there are some individuals that may have coverage through the union or through retiree coverage. It's important to check to see if that coverage is considered creditable coverage. And creditable coverage means that that coverage is as good as or better than what Medicare offers you. Because if you elect to go without credible drug coverage, or you're not in a Part D drug plan and you later on go to enroll in one, you will be penalized. And the penalty is 1% of the average national premium for every month that you went without the coverage. So it's important for you to bear that in mind as well. Now, there are certain programs out there, which I'm not going to go into. You can reach out to our office, that can assist you when it comes to the co-pays for your medications. There is the Extra Help Program, which is a federal program that can assist you with prescription drug costs. There is also the EPIC program, which is a New York State prescription assistance program that can offer you with assistance as well. The next product that I want to talk about is what's referred to as the Medicare Advantage plans. Now, the Medicare Advantage plans, what it is you are going to be stepping outside of original Medicare and choosing to receive your Medicare benefits as outlined by the plan. And the Medicare Advantage plan will cover you for your Part A, your hospital, your Part B, your medical, and your Part D, your drug coverage. It's a combined package deal. And if you're eligible for Part D drug coverage, you have to enroll in a Medicare Advantage plan that includes that drug coverage. You cannot separate it out. Now, one of the things, there's about 42% beneficiaries who elect to be in a Medicare Advantage plans, but there are pros and cons with these Medicare Advantage plans. The pros are that you will have set copay amounts for the different services under Medicare. The cons can be you are locked into the plan for the year. So although you're locked in, providers that are in the plan can leave at any time. They're not locked in any way. The other thing that you want to bear in mind with these plans is if you are a person who is looking to find a way to get the prescription drug coverage without paying out a premium, you may want to consider and look into one of the Medicare Advantage plans that has a zero premium. There are some zero premium Medicare Advantage plans out there. You also want to make sure that you understand whether the plan is an HMO or a PPO, because there is a difference. An HMO is the most restrictive, where you will have only in-network benefit coverage. And if you go out of network, the plan isn't going to cover you. You're going to have to pay totally out of pocket for that. If you're in a PPO, that will allow you both in-network and out-of-network coverage. There's also something I want to point out with the Medicare Advantage plans. Not only do you have the open enrollment of October 15th to December 7th to join into or change one of these plans, but come into the new year, if you are in a Medicare Advantage plan, you will have an opportunity during what they refer to as the Medicare Advantage open enrollment period that runs from January to March of the new year, in which if you're in a Medicare Advantage plan, you can change from the one you're in and put yourself into another one, elect another one for yourself, or you can come out of the Medicare Advantage plan you're in, go back to original Medicare, and pick up a standalone drug plan. What you cannot do during the Medicare Advantage open enrollment is be in original Medicare and then decide that you want to join into a Medicare Advantage plan. That you will not be allowed to do. The other thing that I want to point out if you're looking at a Medicare Advantage plan is that the Medicare Advantage plans have a maximum out-of-pocket limit. And what the maximum out-of-pocket limit is, it's when your Part A and your Part B services add up to a particular dollar amount, and it varies from plan to plan. Some plans have a $7,550 maximum out-of-pocket limit, and some may have a lower amount. There's a plan out there that has a $5,900 maximum out-of-pocket. If you have high medical expenses, you may want to look at one of those plans that may have a $5,900 maximum out-of-pocket, or maybe look for one, I don't know if there's any lower than that. That might be the lowest one. You may want to consider one of the ones that have that $5,800 maximum out-of-pocket if you feel that you may hit that at some point early in the year or even midway in the year, because once you hit that dollar amount for your Part A and your Part B services, you no longer have any co-pays for your Part A and your Part B for the rest of the year. So that is something that you may want to bear in mind when you're looking at those plans. I am going to pass out some information that can give you some guidance on these products that I just described, but the main thing to remember from this is that right now, we are at a time crunch because before you know it, December 7th is going to be here, and you will want to make a decision before then. And whatever you put in place for yourself by December 7th will take effect for January 1st of the new year, and you don't want to be surprised come January 1st. So please take, an opportunity to reach out to our office or to reach out to the library. Okay, thank you. If anybody has any questions, Laura Markovics, who is also with our office and one of our Medicare counselors, is here with me as well and would be happy to discuss your individual situation.
Okay, if any of you have any questions, please raise your hand.
Sure,
and,
go ahead.
You'll have to come up to, Joe will come up to you with a microphone, and he'll try to answer your question. I have a question right off the bat. That's a lot of information for us to absorb. So is there anything in writing that we can study ourselves and in the comfort of our own homes?
Oh, absolutely. If you go onto the Medicare.gov website, all of these products is on the Medicare.gov website. You also should all have received a Medicare Renew handbook. Those are mailed out to every household that has a Medicare-eligible individual. And that also contains all of the information. It's a difficult system to navigate. So I would always encourage you to speak to one of our counselors, because we have that information at our fingertips to be able to guide you so that you can kind of narrow it down.
And is the number that you're going, is the number going to be in the little flyer that you're going to pass out to us?
I could repeat the number again.
Okay.
It's 914-813-6100, and that's our Medicare information line at senior programs.
Okay, so that's 813-6104.
No, 6100.
Oh, 00, okay. Everybody got that?
Yeah, Medicare information
Good.
and assistance.
Yeah, I still get confused, Rosemary. I guess I'd probably rather call someone because, you know what? I don't understand why it has to be this confusing.
So complicated, yes.
I was talking to Laura, who works with you, and she said she is one of the counselors. She worked in the industry before. It's very confusing, and I think very often that's why seniors make a mistake because they don't know. And I got that book. I've never read it. Maybe I'm bad, but you know what? I think I'm typical because it's quite a big book, a little thick book you get. But I want to understand whether or not Medicare is allowed to negotiate direct prices yet.
I know there was talk about that, but you know what? I would really have to go back and see where it stands. The last I had read is that they were trying to get that passed where they would have that ability, but I don't know the end result of that. Laura, do you know?
You have to talk into the mic.
I think it's still in the working stages. They are trying to get it negotiated, but it's not, that easy to do, because of the pharmaceutical companies there's a lot of infighting there between the pharmaceutical company and what the government feels should be. So, that's got to be decided yet, but I think they really need to do something about it because the prices are very high. And I hear that every day from people on the phone. That's one of the biggest complaints.
Oh, of course.
You went through part A, part B, and D. You left out C. What's that?
No, C is another way to refer to the Medicare Advantage plans, the product that we discussed.
Okay.
Okay.
And it can be very overwhelming, so that's why I always encourage. Normally, when I give a full Medicare presentation, just so you know, it's over 2 hours long. So the information that I'm giving you is just little snippets and very condensed. And what we do when we do a one-on-one counseling is, of course, we won't bombard you with all of this information. We'll focus in on exactly what your needs are and what you're looking for, and make it a lot more manageable. Because like you said, most people will shut down. You receive that book and it's this thick, and nobody, for the most part, most people don't even open it. But the key piece is to just always encourage folks to take advantage of the fact that you have an opportunity to select the best insurance product for yourself, Medicare related, before open enrollment ends, which is December 7th.
December 7th, yes, that's why we had the meeting at this month. Prescription drugs is a very big issue with seniors. I mean, I have one prescription that I take that is very exorbitant. Jenny picked it up one day and she said to me, how long are you taking that? I said, no, that's 1 month. It was like $372. So I started to look at it and I'm saying to myself, why are we doing this? And I know it's widely prescribed. It's made in Switzerland. Do you mean to tell me we can't make this drug in the United States of America, which I'm sure would bring the price down? So it's really incredible. What do we do about that? I mean, that's an incredible situation. I know it's very widely prescribed.
Well, one of the things that I would encourage individuals to take a look at is whether they qualify for the EPIC program, which is a New York State prescription assistance program that I mentioned earlier. And this is only available to residents of New York State. If you're in another state, you cannot take advantage of that. And EPIC can help lower your co-pays to where, if it's an eligible medication that's covered under the program, to where the most you'd pay as a copay is $20. So, and the eligibility guideline is you have to be 65 years or older. You have to be a New York State resident. They do not look at your resources, but you do have to meet their income criteria. And they always look at the previous year's income when you're doing an application with EPIC. And for EPIC, the income level is, if you're single, it's $75,000 for the year. Your income cannot be over $75,000, and if you're a couple, your income cannot be over $100,000. Now, there's two different categories depending upon your income that you can qualify into for EPIC. There is a fee plan with EPIC and a deductible plan with EPIC, but I'm not going to get into that, and don't even worry about that. Just bear in mind the income criteria that I just mentioned, the $75,000 for single, $100,000 if you're a couple. And I would encourage everyone to take a look at that program. And even if you are in doubt, just apply, because the worst that they will do is say that you don't qualify for the program. But bear in mind, it's always the previous year's income that they're looking at. The other program is the Extra Help program, which is a federal program through the Social Security Administration. You can apply either directly with Social Security for the Extra Help program, but if you do, an important thing to bear in mind is that they will look at both your income and your resources. Now, there are some individuals who are in the lower income category that automatically get deemed into or automatically qualify for the extra help. These are individuals that have Medicaid, that are SSI recipients, or they have what's referred to as a Medicare Savings program. Now, the Medicare Savings program is a Medicaid program that you would apply for at your local Department of Social Services. But there are great benefits to this program. One is that it'll help pay your Part B as in boy, Medicare premium, and it'll also put you into this extra help program that I'm talking about that can assist you with your co-pays for your medications. So the cutoff for a Medicare Savings program is if you're single, your monthly income cannot exceed $1,469 a month. And if you're a couple, I believe it's $1,980. $1,980, I believe, is for the couple. Now, the good thing about the Medicare Savings program is it only looks at your income. It doesn't look at your resources. So even if your resource was over when you were looking to apply through Social Security, it's not going to look at that. It's only going to look at your income. So we often refer to this as the backdoor way into getting into the extra help program. And I encourage a lot of individuals to take a look at that program because it also allows you certain deductions from your income that can help bring down your income and get you qualified into the program. It allows you to subtract out any health insurance premium that you may have. So if you have a Medicare supplement or Medigap, which is two words that refer to the same product, if you have one of those health insurance plans, you can use the premium deduction. If you're paying for dental insurance, you can use that as a premium deduction. If you have any long-term care insurance that you're paying a premium for, you can use that as a deduction. If you're in a Medicare Advantage plan has two portions to their premium. There's a health portion and there's a drug portion. It only allows you to deduct the health portion of that plan. But again, we have counselors that can guide someone through applying for a Medicare Savings program. So when you're talking to someone, or if you have someone that you're helping, or even yourself, and you're looking at the income, you may not, you want to bear in mind that don't go just off that income because there are certain deductions that can be utilized to help that person qualify.
So what should you have at your hand when you make this call to your office?
Well, you should have some idea of your income. So you should know what your gross Social Security amount is. And we always say, you could go back to your award letter from Social Security. You should have an idea of what your pension is. If there is a pension, if you have any IRAs or annuities, because if you have any streams of monthly income, that would be calculated.
So you should have your original letter. Well, I don't know of anyone that keeps that. Where would
Well,
you
you
get
can
that?
also look at your bank account because your Social Security check will be deposited into your account. But you need to have some idea of what your income is.
Okay, but I mean, you mentioned a number. What was that? What was the number that you mentioned on your original award letter?
It's your award letter that you get from Social Security. That's mailed out yearly to individuals.
Oh.
You really should save that letter. You need to file that away. Don't just, toss it out, because a lot of the programs will require you to send a copy of that letter. So if you don't have it, then we would advise the person to reach back out to Social Security or go online and try to set up an account to see if they can print out that information.
So if you get that letter, and you will get it at the end of the year now, or the beginning?
Yes.
Beginning of the year?
No.
Okay. All right, so, okay. Okay, they can't hear you because, okay, we have a question over here.
The program you offer, the 2-hour program, how do we know about it? Where is it posted?
Oh, well, the The next one that we're holding is going to be a virtual one, and it's on December 1st. And you can call this number, 914-813-6389. We also have pre-recorded ones that if you go onto our website or if you go onto the Westchester Library System's website, we have pre-recorded Medicare 101s, or some of them are referred to as demystifying Medicare workshops, and you can watch them at your leisure.
I'm hearing you say that this is available, but how do we know it's available? Do we get anything in the mail from the county?
If you sign up for we put out a weekly email news, and it lists the different for the upcoming week, or I should say longer than the upcoming week, for the upcoming month, but it's sent out weekly on an email blast, where it'll have information on anything of interest to a senior that's coming up. So these have been listed for months now, these upcoming workshops. So I would encourage you to sign up for that email.
A lot of seniors don't have computers and don't have access to that information. Yes, they can go to the library and maybe get information from there, but it's just the same. And I have another question too, and we'll ask this one. Why doesn't Medicare pay for the shingle shot? When it's advertised on TV, anyone over 50 should get the shot, and Medicare doesn't pay for it.
No, it is covered. It is covered under Medicare.
Wait a minute, we can't hear you. Hello? We have to bring the microphone over to you if you want to speak. So as soon as Joe is done there, he'll come over there.
I just paid $380 for 2 shots, $190 for each shot. Medicare did not cover it.
Where did you receive it at the provider or a pharmacy?
Pharmacy. And they tell you can go to any pharmacy and get it.
The shingles shot vaccine is covered under Medicare, so I would have to look into your particular situation. You can give us a call. Because shingles, pneumonia, the flu vaccine, it is covered under Medicare, but I see you're also waving your hand.
One at a time, raise your hand, and the microphone will come to you.
When
Thank
I
you.
turned 65, you were allowed to get the shingle shot. I got 1 shingle shot. And for some reason, I guess they told me that I would get a second one. In like another year, I could get a second one. I forgot all about it. So I was working with one pharmacy at one time, and then I switched to another one. They said to me, Mrs. Ward, when are you going to get your second shingle shot? I said, I forgot. Well, Maureen got the shot, and I wanted to shoot somebody when I got it, because that second shingle shot cost me $713. Yes, ma'am. And I looked at them and I said, hello. And they said, they said, you'll really have to get in touch with. I said, with who? Because the business of calling numbers, you'd be better off getting a hold of Christ. And I'm dead serious. You know this. All of you know this. So I paid $713 for this thing.
Oh, Laura, you wanted to say something?
Yeah, I want to get this.
hang
I
on,
want to get this shot.
Laura, go ahead.
One at a time, please. Wait for the microphone.
The shingle shot is supposed to be covered under your Part D part of your Medicare. If they're not covering, what I would suggest you do is that you submit a copy of the bill into Medicare. You can appeal it if you feel that it was unjust, and they would look at it and most likely be able to rectify the situation. That's what I would suggest you do, rather than getting stuck with that.
Excuse me. They can't hear you unless you have the microphone with them.
Yes, I'm done, thank you, I'm sorry.
And you also have to look at how it's covered, meaning like the number of years that it's covered. There are certain things that are covered once a year, like the flu shot, but I don't know how the shingles vaccine is it every 5?
Yeah.
I don't know.
Now, they say that you're supposed to get the shingles shot. Now, I've been waiting, it's on the list, and I've had the shingles. I had it for a year. Now, I'm supposed to get the shot, but I won't get it because everyone I spoke to told me, we're not covered. You have to pay for it. And I don't have $600, $700 to pay for these shots.
That doesn't sound right. So I want you to reach out to our office and speak to Laura. Then she can, she can look into what type of coverage you have specifically. Because then, remember, you might be going to a pharmacy that's out of network with the plan. We would have to check the specifics of it. And I know it's that you're shaking your head, but I would want to look at the specifics of why they denied your coverage and telling you to pay out of pocket.
They shouldn't be denying that. First of all, you always have the right, if you don't agree with something, to appeal that decision through Medicare. You always have the right to appeal a decision, and they can relook at the situation, and it can be rectified. Because sometimes, maybe the pharmacy was mistaken on what they were telling you. I would get directly in touch with Medicare on that and have them look at your situation with that, because you can appeal a decision. Any decision that's made that you don't feel that, you were treated fairly in that particular situation. You do have rights where that's concerned.
And Laura is, what she's pointing out is absolutely accurate. Under any Medicare service, if there is a denial, you can appeal it. You can appeal anything that was medically denied or even for your prescription medication. Because under the Medicare program, their determinations are often based upon the medical necessity of something.
Joe Falcone? You have a question, Maria?
Yeah, we're trying to get its attention.
Oh, well, you don't need his attention because you have a
We don't want to
microphone.
interrupt.
Is it my turn?
All right, Maria,
Yes, I do have a question. I agree with all these ladies who are saying that they paid or have to pay for their shingle shot, because I've gone to 2 different places locally, and I even called my provider, and they said, I'm covered, but yet the people are telling me I have to pay for it. It's $40 a shot. Now, you did say we should get a bill and mail it to. I didn't get who to mail the bill to.
They can't hear you without the microphone.
I cannot hear you. I'm sorry.
Oh, thank you. What I would advise you to do is, if you are having that kind of concern where you're being charged for something that you were told was covered, I would really contact Medicare directly and send a copy of that bill into Medicare and appeal that decision, because they might have made a mistake and you would be entitled to be reimbursed for that.
I think I really did call Medicare, and they told me I shouldn't pay for it. But when I went to CVS and Acme, I was given papers from Acme to fill out, and I was told I would be charged. So I have not gotten it yet. So that's why it's very interesting we had a discussion before, and I was saying it's very difficult sometimes for seniors to know how to get from A to B. The word was navigate. I mean, truly, we're not dumb, but we just don't know how to do it. So what do I do now? Do I go and get it and then send it to Medicare? They've already said it's covered on the phone.
I would send it in. I would send the bill in and tell them that, it's not, that it hasn't been covered, that you're being charged for that amount, and they would reimburse you on that. I would tell them it's a covered service and you can't understand why you were told that you had to pay that amount. I would definitely appeal that or file a grievance with Medicare on that. I
And would that
definitely
also
will.
apply to, like, some people who have got it, like, recently? Could they go back and request a bill so they could submit it to Medicare? I mean, if they didn't know. I'm telling you the truth, and I wouldn't
Right.
say the names. CVS and Acme, both lovely people to work with, but they both asked me for my medical insurance, and I gave it to them. And I have to pay $40 each shot.
Right, right. Well, I mean, I would definitely
Okay.
call up on that because that doesn't sound right to me. And I would definitely discuss that with Medicare because the shingles shot is covered and so is the pneumonia shot, so is the flu shot and the COVID shot. Those are all
I
covered
agree.
services.
I agree. They've all been covered. They've all been covered.
And you also want to make a notation, you know, when you're looking at the bill, whether you're being charged for the administering of the vaccine or the vaccine itself, because there will be a separate charge for administering the vaccine. So
And is
sometimes
that-
people can get confused with that.
Is that permissible to administer it?
Yes, yes.
But not 750. I
That
think
shouldn't
with
be.
all,
There is a separate one for administering.
I
No,
think
that
with all
wasn't-
the questions that are being asked, if there's obviously a huge problem here with regard to communication between Medicare and what we are supposed to know in order to make our decisions about what we want.
And that's why, you know, it goes back to where I'd encourage you, when you encounter these issues, whether it's billing, whether it's trying to understand the coverage or trying to make a decision on changing the coverage, please, you know, reach out to us. Because when it comes to the, and different plans, of course, will operate a little differently. So often we would have to reach out to the plan and see what their procedure is for appealing under them, if there is some kind of coverage determination that we are looking at. But we are there to help you and guide you through that process.
Laura, if you're, Diana, if you're giving the information concerning the paying of the shingle shot by a couple of people, would you be able to find out why? Because it sounds like everybody here has to pay. So,
Well, we would need to research it a little. So if the
Okay.
individuals would just reach out to our office, that way we could get the specifics.
Okay.
And then we can reach out to whoever their insurance carrier is and try to, with the person on the phone, of course, we
Yes.
would try to then help them unravel that and get some clarification as to why they were charged that amount, and if that was correct or incorrect, and then how to appeal if it is a determination that's incorrect.
it might be what you just said, the administrative costs. And I didn't know there was such a thing as administrative costs. But that's why I guess when you go in, when I went in for the COVID shots and the flu shot, they take your they want to see your Medicare card as well as your other health card.
Now, for the COVID vaccine, there's no cost. You should have zero out-of-pocket cost for you. They
No,
should
it
not
was
have been.
flu. It was
Oh,
flu.
yeah, that's different. But the COVID, just to let you know, with the COVID vaccine, with the boosters, there is no out-of-pocket cost to you. Although they'll ask you for your insurance information, there is no zero out-of-pocket for you.
I think it's very clear to everyone that this needs to be simplified in some way, shape, or form. What we were originally talking about was the insurance companies who are making it sound like they are giving us something. And I'm going to give you a very simple example, and this is not the letter, but I got a very lengthy letter about something that I should do immediately. And nowhere was there a disclaimer on this letter stating that it was from an insurance company. Now, I think there should be disclaimers. However, I happened to turn it over, and on the other side, on the very bottom, in very small letters, said, "This is a solicitation from an insurance company." Now, I don't know about you, but I very rarely read the back of my letters. So there have to be some rules and regulations put in place as to the fact that they are trying to fool people with the cards that Alice mentioned, with the letters. There needs to be a disclaimer on there. Comes in personal and confidential, like it's very important letter. And if I had not turned it over, which I never do, and at the very bottom, as I said, in very tiny letters, I needed to put my glasses up to see it, was the disclaimer. So this has to be done by our legislators, I think, that they have to pay more attention to this and also simplify it in some way, shape, or form, because it's very complicated for most seniors, for most people, not just seniors.
And it's, you know, it's important, just to piggyback on what you're saying, to understand an advertisement and that you're going to be bombarded during open enrollment, because this is the only opportunity that these insurance companies have to get your business. And a lot of times, you know, I get phone calls from individuals where they're like, oh, wait, I saw this commercial. It says that they'll pay my Part B premium and everything is zero copays and they'll give me over-the-counter medication coverage. I'm like, okay, step back for a moment. They are not targeting you, because that is a plan that's what's called a dual eligible plan. It's for people who have Medicare and Medicaid. You have to be very, very careful. But when you call up that number, they'll redirect you and try to shift you into their Medicare Advantage plan. And they'll say, oh, yes, we advertise it that way, but oh, you're not eligible for that. Yes, you're not eligible for that because you're not a Medicaid recipient. So, again, be very, very careful with any kind of advertisement. But that goes across the board, even beyond with insurance, because there are so many people out there that are fraudulently trying to get your Medicare ID, your Social Security, your bank account. So you have to be so vigilant. And that's why I also encourage people to do not pick up if somebody's calling you, don't pick up that phone and talk to them. If you are going to talk to your insurance company, you reach out and call them. If you're gonna want to talk to Social Security, you reach out and call them. If you want to talk to Medicare, you reach out and call 1-800-MEDICARE. Do not pick up the phone and talk to anyone on the phone where you'd be releasing your, personal information to them if they're calling you, if they're placing the call to you. Always make it going in the opposite direction. You placing out the call.
One of the problems that I see with that is they are spoofing phone numbers that are local.
Yes.
Now, I got a phone call, I think I called you, Tony. Didn't I call you to ask about someone last week? And I said, and I haven't seen this person for a long time. I wondered, why is he calling me? I better call him back. And it turns out, I said to Tony, who knows everything about the town, I said, is this person still living here? He said, oh no, he moved a long time ago, moved to Florida. So what they did is they spoofed a disconnected number, and we're using his name, a very well-known person in town, whom I won't mention, and
absolutely,
you have to be very, very aware of this.
Yeah. I've had individuals say to me, look at that, I'm calling myself. Their own phone number was spoofed.
So how do we rectify that? I mean, we need to get our legislators, I think, thinking about all of this stuff, and also thinking about a lot of these letters and lack of disclaimers that are going out, and also, as I brought up earlier, the price of prescription drugs. Because I can't believe that we can't make a certain product in this country. We have to get it from Switzerland, and therefore I have to pay $372 a month as a copay. I mean, it is not gold. So these are things I think we're going to be addressing in the next year.
Diana,
you have to come to the microphone.
Diana, excuse me, Rosemary. I have a follow-up question on what we discussed before. You said, I think what you said was, maybe they're being charged for administering the injection. Okay. We've all gotten COVID-19, I believe, shots free, because that's what it's told us. So too, the shingles shot is supposed to be given free. So my question to you, and it might sound silly, but nonetheless, it's a question. Is there nothing that government will do to look into why seniors are paying for these shots that are supposed to be free? And stop it? Because you know, not every senior has a pension coming in every month.
I understand.
Not every
but that's-
senior has investments every month. Not every some seniors live on social security. I know that to be a fact. And that is where it's painful. It's painful to sit here and say, well, I had to pay this and it's not right.
I think that's something we have to take up with our legislators.
That's what I was going to say. You know, those are legislative changes that you're, speaking on. And a lot of times when it comes to Medicare and Medicare regulations and any legislation that has to do with that is such a lengthy process to put in place. So what we try to do is we'll take a different approach when we're assisting a senior. We will take a more holistic approach, looking at their entire situation. So when a person calls us and they're calling about the insurance, we won't just take a look at their insurance. We'll take a look to see what else is out there that you can benefit from, that maybe can put some extra dollars in your pocket. That way you can then maybe divert those savings towards those prescription costs or elsewhere. We'll look and see if the person may be eligible for SNAP, which is the food stamp program. So then you'll be utilizing the SNAP benefit to pay for some of your groceries, and that money you're saving from the grocery bill you can put towards your prescription drugs. We'll look and see if they're eligible for the HEAP program, which is a utility assistance program. And if your savings from there can be put elsewhere. We'll look and see, like I mentioned before, the Medicare Savings program to help them save on the Part B premium or the prescription copay assistance programs that are out there. So we will look at the full benefit package, so to speak, and try to match it up to, if a senior is eligible for it, help them apply and help guide them through that so that they can get these additional savings. Because why not utilize what we have in place now that we can take advantage of?
Okay, well, thank you. There are a lot of Alice, did you have something else? You have to come up, dear, because
Sergio has his hand up.
I see him.
One of the things that I'm going to do when I leave the town is become an advocate for a couple of things. But this is one thing, Rosemary, you can help the community with, and I will sign up. You know, when a legislator looks at a letter that has been signed by a lot of people, they tend to want to look at it and see what the issues are. The other thing, in New York State, you've got to pass the New York State Insurance, Department of Insurance. That letter you got is a letter that we could send to the Department of Insurance and say, is this what you want your people to do? We recognize they put on it's a solicitation, but how many people you know look at the back of a letter?
Exactly.
I would do that. I think that in this day, unfortunately, what we have to do is begin to advocate for ourselves.
Absolutely. Okay, I think Sergio, who is here, he's our new councilman-elect, has a question. I think I saw our supervisor here as well. He's going to make some comments to us.
So, just focusing on a very narrow issue, because it seems there's a lot of confusion over the shingles vaccine. So is it possible for your office to find out exactly what the Medicare portion is? Forget about Part B and all of that other stuff. So this way, and if you want, you could relay it to me. I'd be happy to relay it to Rosemary. And this way we could actually report to our seniors who aren't getting the vaccine because they're apprehensive about the cost and what they're going to be billed at. maybe we could get back to them and say, hey, Medicare is paying this portion, and you have to check with your supplemental to see if they're going to pay the additional portion or whatever it is. So this way they'll have a clear understanding, and then they could figure out exactly what they need to do and then get the vaccine, which is, I think, very necessary.
Yeah, we'd be happy to do that.
Okay, so can I give you my email address?
Oh, sure.
Or my phone number, either way.
Yeah. When I get back to my pocketbook, I'll
Okay,
grab
thank
it.
you very much.
Thank you, Sergio.
Oh, and send it, yep. Okay.
It was the question I asked you earlier.
So you giving me another job to do, Alice?
Well, you gave me jobs to do
that's-
when I walked in
But you're
today.
used to it.
You're right. No, I think it's important, and you agree that they would have to talk to you separately because of whatever the issue was. I would assume when and where they got the shot. That'll matter.
Yeah, we could look at we can look at the specific cases, but what we can also do is we'll provide you with the information of the different Medicare services and how it's covered. It's a one-page sheet that I can actually easily send out to you guys, and that way you'll have a better understanding how often a particular service is covered and how it's covered.
Okay, very good. Thank you. We really appreciate your coming up here.
You're welcome.
And talking to us. Come on back
We have one more
anytime.
question.
We live in Westchester County, and because we do, our premiums, as well as our taxes, are higher than anybody that's in Putnam County or even in Connecticut. Why is that based on our zip code and because of where we live, that our premiums are higher?
That has to do with actuarial science, where they do these studies and make that determination, and it's a complicated kind of formula that they use. But maybe Laura, who was in the insurance industry, do you have anything that you'd want to add on those premium determinations?
In New York State, the premiums are community rated, so it goes according to community of what they charge for the price, and many of the companies are allowed to set their own rates. So that's why sometimes you'll see things vary from one plan to another. So, that's what the reasoning is kind of behind that. That's why you see certain rates in certain areas.
Okay.
And we do also see that issue raised a lot when it comes to the Medigap, the Medicare supplement plans. Because when you're looking at those costs, you will see you could be living in one area and the costs are considerably different than in another area. And that is, like I said before, it has to do with the individual insurance company making that determination based on their own study.
Okay, I think we have to move on. We have a lot of things on the agenda. Thank you so much, Diane. We
You're
appreciate
welcome.
your coming. We have another lovely guest, Ellen Bloom, my friend Ellen from New York Presbyterian Hudson Valley Hospital, who was kind enough to provide lunch for us today.
Thank you. I will not keep you. That was an excellent presentation. Oh, my God. I just wanted to say we're so pleased to be able to provide you with lunch on behalf of New York Presbyterian Hudson Valley Hospital. It's always a pleasure to treat you, to treat your families, to treat your friends. I want you to think of us anytime you're in need. We have our emergency room that's 24/7. And as part of the #1 hospital in New York Presbyterian, we give you access to Columbia physicians, talented and skilled experts in so many different fields. Next month or the month after, we will be coming back with a physician who will speak with you about a very exciting project that we're working on now, our cardiac catheterization unit. And we expect to open that up in the first quarter of 2022. And that will bring life-saving technology for diagnostic and treatment of different heart issues, problems, disease, right here. Normally, and to this point, we've had to transfer you either to the medical center or to our affiliate Lawrence Hospital in Bronxville. Now we can do it right here in Hudson Valley. So I look forward to bringing you the medical specialist that will talk to you in detail about this exciting opportunity. And so thank you, Rosemary.
Wonderful. Thank you, Ellen. Thank you so much. Thank you. And now, last but not least, of course, is our supervisor, Yorktown Supervisor Matthew Slater, and he's going to give us a bit of an update, I guess, on COVID and other senior issues.
All right. Good afternoon, everyone.
Good afternoon.
It's great to see everybody here. Before I begin, I want to recognize Alice Roker, my good friend and colleague. Alice, she made me nervous. Did you hear her? What'd she say? She said she's going to be an advocate.
Yeah.
Which means she's going to keep me very, very busy.
Yeah.
But Alice has been a great, great friend and a great mentor for me, as well as with Councilman Patel. And I want to personally thank her and acknowledge her service to our town for a number of years. And if we can all just please give her a big round of applause, I'd appreciate that. We have been quite busy here in town. We have a number of things just to talk about briefly. Of course, Noreen O'Driscoll has been very, very busy. Noreen, the guardian angel of Yorktown seniors, her and her staff. Yep, a big round of applause for Noreen. They've been doing a great job. They have welcomed back seniors to the Nutrition Center last week, which was fantastic. We saw some great improvements to the Senior Nutrition Center itself. New floors, freshly painted walls. We have air purifiers installed there to make sure that our seniors are safe when they come and visit. And so it was great to be back with our seniors in the Nutrition Center. We are planning on having our senior groups begin to return in December. That's something that we've discussed. So, yep. But we understand. We're taking our time. It's important for us to take our time, and I know how eager you all are to get back, and we are eager to have you back. But we want to make sure you're safe. Okay. So, but again, this December we are planning on having our senior groups return. You heard about HEAP, which was great. Something I wanted to talk about because we do know energy prices are going up. Home heating prices are going up, and so make sure for our seniors, if you are eligible for HEAP, please take advantage of that. We also have the Yorktown Home Heating Plan. If anyone has questions on the Yorktown Home Heating Plan, please call my office, speak to Jenna Belcastro, my assistant. The number's 914, because don't forget, you have to dial an area code now. I made that mistake yesterday. 914-962-5722, extension 200 is the direct line to my office. So please, if you have questions about the home heating plan, or HEAP for that matter, give us a call. I do want to thank Paul Martin for a wonderful Veterans Day parade. Paul's not here today, but Paul has organized the Veterans Day parade in Yorktown for a number of years now. It was another fantastic event down East Main Street in Shrub Oak to pay tribute and thank the men and women who have defended our freedoms, defended our way of life, and made sure that we get to enjoy the meaning of America. And I also want to recognize Tony Grasso, one of our World War II veterans here in Yorktown, a great member of our community who has done so much. If we could please give Tony a big round of applause. Don Grasso, always good to see you. If you went outside, you might see some construction, some work being done on the gazebo at the DeVito Gazebo at Veterans Field. Happy to say, thanks to a public-private partnership with the DeVito Foundation and the Yorktown Lions Club, we are in the process and will be completed. Will be finished this weekend with the first phase. But we have made some much-needed improvements, and I want to again acknowledge Councilman Vishnu Patel, because this has been a passion of his for quite some time, to upgrade and renovate and refurbish the gazebo. But we were able to, the handicap ramp was not in good condition, to say the least, so we have been able to basically completely overhaul that and fix that, as well as the railings in the gazebo itself. This is a first phase of a project that we think is so important, because the gazebo is really an iconic piece of our community that has great meaning to a lot of people who have been here for a number of years. So we're very happy to be taking part of that. It's been done with all volunteers, believe it or not. We put the word out, and we've had a number of volunteers from the Lions Club, like I said, come out. We had Tom Brady from Jefferson Village. He's a retired union carpenter, and he had nothing to do last Saturday, so he came out, and we put him right to work, and he helped us out. It was fantastic. So we are again expecting to be completed this coming weekend with the first phase. Booster shots. Let's talk about COVID for a little bit. So COVID, unfortunately, COVID's still here. And I know the holidays are coming up, and I'm just going to urge caution to everybody. Just make sure you're safe. That's all I'm going to say. please, please, please make sure you're safe. We are offering booster shots, COVID-19 booster shots. We have a booster clinic actually right here tomorrow, which is Saturday. If anyone is in need of a booster shot, you can call if you can't get online to make an appointment for yourself, you can call my office. Again, that's 914-962-5722, extension 200, and our staff can assist you in scheduling you for a booster shot. So we are planning on continuing that. We also started pediatric COVID-19 vaccinations as well. We had 300 children from the age of 5 to 12 last week. We have another 200 already booked for this coming week. So it's great to see that people are taking advantage of the vaccine, which right now we know is the best weapon to stop this terrible virus and to get us back to life as we want to see. So again, if for any of our seniors looking for boosters who don't have access to a computer, just call my office and we're happy to accommodate you. Jim Moderano, where's Jimmy? Is Jimmy still here? Jim Moderano, our Parks and Rec superintendent, does a great job. He wanted me to remind everyone that senior winter fitness classes are currently open for enrollment. So if you're looking for something to do in January and shake off some of the winter blues, come on out and enjoy some of the winter fitness classes. We are planning currently to have them here in the Cappellini Center gym. Any questions, please contact the Parks and Rec department and they can help you with that. Just a few other things that we've been working on. We do have a proposed town budget. There is a public hearing on December 7th. I'm happy to report that budget provides a 0% tax increase for the general highway and library funds. Those three funds are the only funds that all Yorktown residents pay into. This protects a historic tax cut that we were able to provide last year. It was the first time since 1992 that we actually were able to cut the general highway and library budget tax rate. So we recognize that times are tough for a lot of people, and it's important for government to recognize that, and so we are trying our best to be as fiscally responsible as we can. Thank you. And our audit report from 2020 showed just how well our team managed, and I say team because I mean that, our finance team managed and our town board managed the crisis of COVID. We cut spending by millions of dollars. We increased our rainy day fund by millions of dollars, and we really put Yorktown in such a really strong financial position for us moving forward. And so it's important for us to continue to build on that. Just a touch on senior housing. I know Rosemary will never let me leave without talking about senior housing. But the last time I was here, I talked about the overlay district legislation that we are trying to enact. That's going to provide flexibility for new and creative development here in our business hamlets, in the Heights Hamlet and in the Osceola Hamlet. The town board has set a public hearing date for this important legislation, not any specific project, just the enabling legislation for people to look at the future of the Heights Hamlet and the Osceola Hamlet. That public hearing is December 14th, and it will be here in the Cappellini Center gym, starting at, I believe you said 6 p.m. 7 p.m. Thank you. So 7:30 for the public hearing. And I want to thank our town clerk, Diana Quast, for helping organize that as well. I also want to talk about our town clerk for a second, because she's got a great idea that I think the seniors are going to love. And she's looking to update the peddler's law to introduce a do not knock registry. And I think that's a wonderful, wonderful idea. She deserves a big round of applause and some credit for that as well. For getting that initiative started. So she's working diligently on putting that legislation together to bring it to the town board for our consideration, and we'll keep the senior advisory committee
I'm sorry, Matt.
posted on that.
We didn't hear exactly what you said about the seniors.
I said I think the seniors are going to appreciate the fact that there will be a do not knock registry. So solicitors won't be able to come if you sign up. They wouldn't be able to come to your door. I'm sure people have seen, you've got, I've seen Verizon out there. I've seen other companies who are going door to door trying to sell things. And the do not knock registry that the town clerk, Diana Quast, is proposing, if you sign up for it, it would prohibit them from actually visiting your home to sell you things.
Oh, good.
So,
no, we didn't quite hear you. So
yep,
thank
no
you
problem.
Thank you for repeating that.
No problem.
Unfortunately, some people that come into the neighborhood do not pay attention to the laws. So I have had people, even despite the fact that I have a do not trespass sign up, that still come through and knock on the door.
Yeah.
So this is so what do we do? I hope that that's going to be discussed, what exactly we do in that.
We'll definitely have a conversation with our code enforcement and our police department about how we can make sure that enforcement is included. But I think it's a very important first step for us as a community, and I think it's a great initiative. So I think a lot of people are going to appreciate it and take advantage of it.
Yeah, absolutely, absolutely. As far as the overlay zone is concerned, if one wanted to get a read on it, what was discussed at the last meeting.
And it's really important that you do look at the last meeting. How do we do that? Yeah, so the last meeting, we had a presentation by, just so everyone understands, we actually hired consultants to go do a full study on the proposed legislation for the town board to understand what the potential impact could be. And they made a comprehensive presentation just this past Tuesday.
Yes,
that video was available. It's being played as a separate video on the government access channel. So that's channel 20 for Optimum, 33 for FiOS. It's also on the town's website, and we are currently working with the town clerk again because we want to put a full package together so people can go online and they can get the actual legislation. There's been multiple presentations made both by our consultants and the planning department of the town of Yorktown explaining why this is so important for the future of our community. And so we're going to have all that together right in one spot on the website so everyone can go watch the presentations, read the reports that have been produced, and also read the legislation.
Okay, that's good. That's good to know.
Yeah, you're right. Yep, and that is also on the planning department's site, specifically on overlays. So a lot of that information is already out there.
Good.
Okay,
it's good to know.
And then the last thing I just wanted to point out, while we have Sergio Esposito, the current president of the Yorktown Chamber of Commerce, Small Business Saturday is coming up. So really important, and this is going to be a theme for the town of Yorktown. I hope it should be a theme every day, but especially this holiday season. We got to shop local. And we have to really think about the different, and Yorktown actually has some amazing shops and amazing retail that you can go to for the holiday season, and not just the holiday season, year-round, but this holiday season, we're going to see a presentation on Tuesday, this coming Tuesday, about a Shop Local campaign that we're hoping to launch in conjunction with the Chamber of Commerce. So I just want to make sure that we give special treatment and attention to our small businesses this holiday season. I can tell you that my family for Thanksgiving, we got our turkey up at Hemlock Hill, and so that's where we need to think about going. These whether it's A&S Pork Store or the different farms that we have here in Yorktown, which is great. If you're going to go get your Christmas tree, right, you can go to Wilkins Fruit Farm, and another great spot right here in Yorktown. And when you think about shopping, you've got great stores right here, either in the Jefferson Valley Mall, which by the way is 90% full, which is great. People don't realize that. Or even the independent shops like Wishes, which is just around the corner. I get all my mom's presents there these days, and so many other stores that we really are lucky to have here. So, Yorktown's a unique community because I genuinely believe it's one of the few you can go to where you can go cut down a Christmas tree, you can go shopping, you can go out to a great restaurant, all in one community. And we should be so thankful that we have that right here in our backyards and take advantage of it. And because it goes to help the community, help our neighbors, and help our small businesses. So those are all things we're going to be talking about.
Absolutely.
Matt, if I could also add to that, don't forget that restaurants and services in the area, their gift cards are great gifts as well, and they're not stuck on a boat coming from China.
That's correct. And Councilman Lachman, thank you for your thermos, because United for the Troops, two more things I wanted to talk about, three actually. United for the Troops, if you don't know United for the Troops, they package goods, they do care packages that they send to men and women serving overseas in the military. They actually have now sent over 26,000 boxes to military members. It's incredible. Right. There is a red bin when you walk into Town Hall. If you want to donate some goods, there's a list right on the town's website of things that they're looking for. It's a very rewarding experience. They're a phenomenal organization. Every dollar that gets raised or every product that's donated gets put right back to our military servicemen and women. So thank you, Councilman. And Councilman Lachman also heads up our Veterans Advisory Committee as well.
And just like Matt was saying, 100% volunteer. There are no expenses. Everything gets put into the program. And Jim Ratchmit, he and his wife Patty started this in honor of their son, who was serving at the time.
Yep.
He does a lot in our community as well. In fact, he was with, this morning, he was with myself and Tony Grasso at the Country House for our Veterans Social that we do there on Friday mornings. Yep. And he's, he's always been a big supporter in our community.
He may live in Mayapack, but I'm pretty sure he's a Yorktown resident. So.
I think so. He loves Yorktown.
The other thing, just for people who may have family coming into town and they're looking for something to do on Thanksgiving morning, we're bringing back the Hudson Valley Turkey Trot, which is really important because it's a great fundraiser for our food pantries. And food security and food insecurity is a significant issue. People don't think about that when it comes to Yorktown. We have our food security task force that we started in the wake of COVID that's done some really great work by bringing our food pantries together here in Yorktown and sharing resources and ideas. And so the Turkey Trot runs from Front Street up and through the Heights, up to 118 and back. It's a great run, great way to kick off your Thanksgiving, and then you don't feel so guilty when you go home and chow down and have some great food all day. And the last but not least that I wanted to make sure I announced, December 4th, if you want to get into the holiday spirit, please come back out for our Yorktown Holiday Lights Parade. It is a great event. We are doing it the traditional way, which is the parade through down Commerce from Front Street, all the way right here to Veterans Field, where we light the Christmas tree with the help of our friend from the North Pole. And it's a really fun family event. We usually get a great crowd, and we're just so thankful that we can bring it back for the town of Yorktown. And also for those who want to join, there is the menorah lighting on November 28th, which will be right outside here at Veterans Field. So a lot of exciting things happening here in the town, both governmentally but also from a community standpoint. And it's always great to be with everybody here. And I just want to wish everyone a very, very happy Thanksgiving and have a happy and safe Thanksgiving.
Thank you.
As always, if residents need anything from the town or from my office, I'll give you the number one more time, 914-962-5722, extension 200. Just give us a call, and we'll do everything we can to give you a hand.
Thank you so much, Mr. Supervisor.
Thank you.
The one thing I wanted to mention, as Maria Fama reminded me of earlier, that we do have a suggestion box at Town Hall. I believe it's right outside of the clerk's office, if I'm not mistaken. If there are any subjects you would like to have us perhaps think about giving talks on over the next year, we're certainly open to suggestions. I can't promise you we can resolve all your problems, but we can hopefully bring up some subjects that you're interested in and maybe direct your concern to someone, the appropriate person in the town. So we thank you all for attending. We wish you a very happy and healthy and blessed Thanksgiving. And our next meeting is going to take place on Friday, December 17th. And we look forward to seeing you all here. Thank you so much. Thank you to everyone, to our committee, and to all of you for coming. Thank you.